First of all, the simple interrupted or direct loop technique. In that, from the first flap, from the one flap, needle insertion is done from the outer aspect and in the other flap from the inner aspect. Needle inserted at 90-degree angle and just as the same depth of the first flap. And then the knot has been tied. In the figure of 8 suture, the needle should be passed from the outer surface of the one flap again. It is passed from the outer surface of the other flap. This should be properly approximated at the same level. Now, the needle is passed from one flap from left to right direction. This is also important when you are closing around the implants. And from the opposite flap, the right to left side. This is the horizontal mattress suture. Sorry, I have talked about this is the horizontal mattress. Similar to this horizontal mattress suture, the crisscross suture we will perform. That is again your needle is passing from left to right side. This is also useful to close the implant. Again in the other flap, left to right side. That is the cross mattress or crisscross suture. Another type, which is most commonly used, horizontal mattress suture, we are going to perform. It is started from the one flap, like direct loop technique or simple interrupted suture. It should emerge from the other flap. Again, from the one flap to the another flap. Then the knot has been done. Just the horizontal mattress suture. This can be performed along with the continuous sling suture where the interdental papillae broad. Now the vertical mattress suture. The external vertical mattress suture. So in external vertical mattress, this is to close the flap with the greater height, the vertical mattress suture. The external vertical mattress suture. Sling suture and the internal vertical mattress suture. So in internal vertical mattress suture, the deeper tissue approximation is there first, and then the superficial tissue approximation can be done. So like the horizontal mattress suture, the needle is passed from the one flap to the other flap with a deeper tissue approximation. And now the superficial tissue approximation near to the margin from the other flap to the previous one. This is the internal vertical mattress suture. Now the suspensory or sling suture. Suppose only one flap reflection is there in relation to the tooth. Suppose this is the tooth and only the buccal, this is the buccal flap. Only the buccal flap reflection is done along with the tooth. And we want to close this buccal flap by the sling or suspensory suture. So this is how we can do. So start from the distal papilla, distal interproximal papilla. Now encircle the tooth. Go to the mesial interdental papilla. Now go at the original insertion position and make a note. So we have used the tooth to approximate the flap. So now this buccal flap is properly approximated along with the tooth. So we have seen the simple interrupted or direct loop suture, the figure of 8 suture, the horizontal mattress suture, cross mattress or crisscross suture, another horizontal mattress suture, another variety, or can be called the external and internal horizontal mattress, same the external vertical mattress, and internal vertical mattress, and the sling suture. Thank you very much to all of you. Hope you have got something from this video. Thank you very much to all of you from the Dr. Anil Trivedi. This is Dr. Anil Trivedi, lecturer at FDS DDU, Nadiad. Thank you.